the differentiation. If I come in because I say to you that I like cannabis because it helps me sleep better, medical. Let's say I'm coming in to cannabis because it's the end of the day and I want to relax more, medical. I want to ease my anxiety, medical. Anything that you say, I don't, it could be an adult use when the patient steps up to the counter, and every one of them to me is a patient, when they step up to the counter and they're asking questions, well, I just want to have something that, doesn't make me want to go sleep, but I'm more alert at work. To me, that's focus, that's medical. So we ought to address that way as an industry. That's one of the probably biggest issues. And I would agree with you that, if I wish more and more of the dispensaries would take on the attitude that just as important as location is for real estate, education, especially right now, is going to be the difference between success and failure in this industry, period.
I couldn't agree more. And yes. I understand the distinction between a medical license and an adult use, but at the end of the day, anyone that walks in, exactly as you said, there is a health and wellness reason, even if that's not the main one that they give us.
If you deserve a quality formulated aspirin, which doesn't need a prescription, then why can't you have a quality formulated, substance like cannabis done the same way? They formulate aspirin at the GMP national level, FDA approved, be it for you to be able to sell them on the shelf. So that's not a prescription medication. And not even on schedule now. I think aspirin has been descheduled since it was first created, and is probably the most deadly substance you have in your medicine cabinet at home, because your child gets a hold of it, goes in and takes a bottle, they're going to bleed out on the kitchen floor before anybody can come home and help them. Yet we sell this and can let children buy it at CVS. The kid can walk through CVS, pick up a bottle of aspirin, throw it in a cart with some Juji Bears and some Coca-Cola and walk out the door, and nobody's going to question it. They're not going to ask for the age of a kid buying aspirin.
Right.